All right, we will move on to our fourth question here, and this is a question from the audience. And the order of this question, we will start with incumbent Zack Space on this. Zack, it is a fairly long question. Bear with me on this, all right? I have 2 minutes to read it. You have 2 minutes to respond. Depending on who you believe, 1 out of 6 Americans do not have health insurance. Breaking it down to a one-on-one issue with the new health care law, why should the 2 people on my left and the 3 people on my right pay for my health insurance?
Okay, I want to address it as a question about healthcare and the injustices that exist in our healthcare delivery system in America. And they are significant, and they are real, and they are profound. We get the least bang for the buck out of any civilized or first world or even developing nation when it comes to the money we spend on healthcare. We're spending 17% of our GDP on healthcare. If we don't do something, we'll be spending 20% by the year 2025. The healthcare bill that was passed in March of this year does not, in my opinion, adequately address the problem. There are a lot of problems with it. Foremost, it does not adequately control costs, which is the primary problem with healthcare delivery. It pays for itself by imposing a tax on the middle class by taxing benefits as income. That is an egregious error, in my opinion. And it does not keep the insurance industry honest. There's no mechanism that does that. It pained me to have to vote no on a bill that dealt with health care, Bob, because I have been passionate about the need to bring common sense reform to healthcare delivery in America, but I couldn't vote for this bill. Despite the overwhelming pressure from both my leadership and the president, I was in the Oval Office with the president by myself for an hour 3 days before this vote, trying to be convinced to vote for it. It wasn't right for my district, and it was not good for our seniors. It was not good for our hospitals. And believe me, I've had many, many conversations with every hospital administrator in our district, including Bill Harding, who's here today. And it wasn't effective in terms of addressing the challenges that should have been addressed. We need healthcare reform. I'm not talking about repealing this bill, because there are some good things in it. We need to keep what's good there and change what's bad, and there's a lot of bad about it.
All right, thank you, Zack. Bob Gibbs, would you like to hear the question again? All right, the question again is, depending upon who you believe, 1 out of 6 Americans do not have health insurance. Breaking it down to a one-on-one issue with the new health care law, why should the 2 people on my left and the 3 people on my right pay for my health insurance?
Well, they shouldn't. What they passed in Congress is going to bankrupt the country. We can't afford it. And one thing that Congressman Space just said that I agree, and I've been saying it, it doesn't address the escalating costs. We need to address the escalating costs. And what we need to do that is tort reform, address the defensive medicine costs. We need to have portability where you can buy insurance, health insurance across state lines up with competition. And medical savings accounts, we need to incentivize that where you have an account that your employer kicks in, you as an employee kick in before taxes, that stays with you. And really, a new concept here is use that for preventative routine care. So when you go into your annual visits with your physician, you pay for it out of that account, and you have the health insurance to pay for it, and you really have a problem. So that's going to bring some personal responsibility. It's also going to address the liability issue because you're going to have a more frank conversation with your physician. But the bigger thing it's going to do, it's going to drop administration costs, because when you go to see your doctors, too many times your physicians are filling out paperwork, fill out that forms to get the rest of it from the copay and all that. And so we need to address that. And I like to see the states, encourage the states to do group risk pools, because we're paying for those people anyways that are medically uninsurable, and get group risk pools and get them in there with in partnership with the private market system, and try to develop plans and let the 50 states, go at it. Don't let the federal government go at it, because they're not going to do it right, because they don't do much thing right anyways. And so what we need to do is let the states experiment on how to address the medically uninsurable, and hopefully one or 2 states might get something that's close and we can work off of, because I don't think there's a silver lining bullet to what the answer is for the people that are truly medically uninsurable. So I know this is a tough issue for Congressman Space to talk about, because he did vote for it twice before he voted for it against some final bill at the last minute when apparently Nancy didn't need his vote.
All right, thank you, Bob. Lindsey Sutton, Constitutional Party, your feelings on this?
The federal government, much to your by surprise, what I'm going to say, Constitution to be involved in my or your health care. If our society decides that we need to do something for those who don't have health insurance for whatever number of reasons they might be, let's approach this at the state level. And let's let the federal government be involved in things such as defending our borders, defending our country, and quit defending other countries overseas. I spent 20 years in the United States Air Force in foreign countries, protecting other people's borders. And we have borders here that aren't secure. But yeah, we're going to take this healthcare issue, and we're going to spend trillions of dollars with this, and there's no constitutional authority for it in the first place. It likely won't work in the second place. They, being the states, Massachusetts tried it, didn't work. Tennessee tried it, they finally got something that sort of worked. But if Ohio decided they want to try it, how about we keep the federal government out of it and let the people of Ohio decide if they want to do it?